Good evening. I'm Renee Powell with Oklahoma Family Network. Welcome to Toolbox Tuesday. Tonight, we are very fortunate to have Julie Sanders as well as Christy Williams. Um, Julie is the Director of Transportation for the Southwest Oklahoma Regional Transportation Planning Organization. And Christy is her colleague that is going to add some awesome, helpful information for families going forward. Um, Julie works to improve transportation systems and strengthen regional collaboration across southwestern Oklahoma. In her leadership role, she partners with local governments, tribal nations, state agencies, and community stakeholders to identify transportation needs, develop regional priorities, and advance projects that improve safety, mobility, and economic opportunity. With a strong commitment to strategic planning and public engagement, Julie helps coordinate long-range transportation planning efforts that connect rural and urban communities while ensuring local voices are represented in the decision-making process. She is passionate about building partnerships that support accessible, efficient, and sustainable transportation solutions for the region. Um, she is recognized for collaborative leadership, practical problem solving, and dedication to enhancing quality of life through thoughtful transportation planning and regional cooperation. And actually, here recently, the Southwestern Oklahoma Development Authority gave her a Recognition of Excellence Award on June the 9th, I believe, for her leadership in advancing transportation planning and mobility solutions across Southwest Oklahoma. So thank you so much, ladies, for being here. I'm going to hand it over to you and we'll go from there.
Well, thank you. I think Christy and I will probably do a tag team. That's generally how this works. But thank you for allowing us to speak. Kind words for our transportation planning initiative. On the slide today, you'll see the state of Oklahoma, and you'll see the yellow shaded area. Those are the 16 counties that Christy and I work in for transportation planning. There are similar organizations across the state. They're called regional transportation planning organizations. And there are mobility navigators across the state. And I think, Christy, you put the link in the chat that will take you to the ODOT's mobility navigators. So kind of give you a background. With Christy started as a mobility navigator 3 years ago, a little over 3 years ago. And we were in the beginning stages of developing a regional transportation plan. And through that planning process, transit, lo and behold, was the number one issue, the number one barrier, the number one concern to access medical, to access employment, to access food. And when you live in rural Oklahoma, you know, the nearest grocery store may be 30 miles. It may be 50 miles. Your doctor's appointment may be 75 miles. And so transportation without having a vehicle and what's called a fixed route system, which is the transit system you see, you know, in the Lawton area, the Oklahoma City area. We have what's called demand response services in rural Oklahoma, where you call in 3 days in advance. And sometimes they go where you can pick you up and sometimes they can't. So we put our heads together and we started looking at ways to expand transportation. And I'm going to flip through the slides. And as we went through our public meetings, these were the comments. I can't get to the doctor. I can't get to the grocery store. I can shop at the local convenience store because that's the only thing available. And we know that's not the healthiest place to go. So as we started working through that, through the last 3 years, working with Christy and building the partnerships with many, many different agencies to address transportation, the State Department of Health opened up an opportunity to provide input into meeting the rural needs in Southwest Oklahoma to get people healthy. And that was part of the Big Beautiful Bill. You may have heard it, the Rural Health Initiative through the Oklahoma State Health Department. And they went across the state asking people what their input were. And it kept coming back, well, you know, it's great to have doctors, but if you can't get there, it doesn't matter. You know, if we're having to use an ambulance to get to the hospital because we can't get to our primary care physician, that's a problem. And we had worked with some mileage reimbursement programs as pilot projects in some of our areas. And we sat down and we wrote a program for 5 years. This big, beautiful bill funds this program for 5 years to look at rural health and access to rural health. It's a big project. It's a big lift. We signed our contract March 30th. And so we've really only been operating a quarter, and it's like a bomb has exploded in our area. The biggest program that we've got right now is called the mileage reimbursement program. So it reimburses to medical appointments, to wellness, and to the grocery store, or to the food bank, or to congregate meal sites, or to the farmers market. You can be reimbursed to go to the grocery store right now 4 times a month. And that's huge in our area. And if you're familiar with Beckham County, far western Oklahoma, and little town of Eric, they have no grocery store. Their closest is Elk City or Sayre. And if you don't have a vehicle, you can't get there. So as we were developing this program, we didn't want to just look at getting to the doctor's appointment. We wanted to be able to get you to the grocery store to get healthy foods. And we have a definition in our program of what a grocery store is. It's not the Family Dollar that's got the couple of shelves of fresh produce, and it's not the Dollar Generals. It is a grocery store that has a selection of fresh fruits, fresh vegetables, fresh dairy products, and meat products. So we were very, very concentrated on how we looked at access, and we really focused it around the social determinants of health. With this pilot project, and we call it a pilot project, we started it in our 16 counties. And so that's the first phase. We started it in our 16 counties, started it March 30th, and we will expand into other areas of the state starting next year. We will take applications from the Regional Transportation Planning Organizations. There are 4 others like us, to see what part of the state we can expand to. We will select 2 in our region from the state, and they will roll out the mileage reimbursement program in their region through that. And then a year in 2028, we'll roll out in phase 4 to the other 2. So right now we are bumping our knees, scratching our heads, saying, oh my gosh, can we do this? To implement and to get all the questions answered, all the forms, and develop a process so that as we roll it out into other state regions, that we can make sure that it's successful. The goal is that this will be sustainable. And the only way it's going to be sustainable is through word of mouth and through people using the program, letting their elected officials know this is working. This is a program that's successful. And then, hopefully working with our other state agencies, we can prove that, there's been we've moved the needle on health, and we've reduced the cost because people are going to their primary care doctors because they have a way to get there. Or if they need to go to education classes for diabetes or cardiovascular, there's a way to get them there. So in the next 2 years, we will roll it out to other areas of the state. This is only eligible for communities less than 50,000. So if you live in Lawton, you're not eligible for this program. If you live in Tulsa, Oklahoma City, Norman, the population has to be less than 50,000, and that is the federal rule. So as we roll this out, we are speaking constantly to different agencies and organizations to make this available. This is a program that is reimbursable. And when we say reimbursable, the individual has to call a mobility navigator and go through an intake process, and they have to verify. Eligibility is number 1, you can't be eligible for any other funding. So if your trip is eligible for SoonerCare, unless you've got a denial, then it's not eligible. But we also know that SoonerCare doesn't cover trips to the grocery store. So it's, our navigators go through an intake and look at where you're going. They look at how far you're going. We do not find the drivers. You either drive yourself or find someone to drive you. And then whoever is the driver will fill out the mileage reimbursement form, and that check will go back to the driver. Right now, the reimbursement is 60 cents a mile, and we're trying to process the claims within 2 weeks. In some cases, it's taken up to 30 days because we've had some problems with the post office and with people on vacation. But right now, it's unlimited trips except to the grocery store. And there's if you're living along the periphery, the border states, we also cover, transportation within 75 miles across the state line. Christy, do you want to
Yes,
talk a little bit more about what we're doing?
yes. So just like Julie said, let me kind of explain to you what happens when a client calls the mobility navigator. And as Julie said, we definitely want them to call the mobility navigator first. I will say in our area, and as this rolls out into the other areas, it will be the same. I can't foresee it being any different, but the call intake is huge. So I have, what we tell our clients, be sure you leave a message and the mobility navigator will return your call as quick as possible in the order that basically they receive it. But when a person reaches out to our mobility navigator, one of the things that we really wanted to strive in doing is not asking that deep personal information. We do not ask their social security number. We do not ask their income. We only ask basically, where are you coming from? Where are you going to? And for what purpose? We do ask what their health insurance is. And the reason that we ask that is, as Julie noted, that if it's reimbursable by another program, then we absolutely cannot put it through this program. However, what we have found out is that a lot of our clients that call us for help because they've heard about this on the radio or they've heard about it from a friend is when they call us and we find out that they are SoonerCare or Medicaid eligible. They did not realize that there is a mileage reimbursement program out there for individuals who are Medicaid eligible. And so, and especially, some of our older clients do realize that, but most of our younger clients do not. And when we're visiting with them and we say, well, you're Medicaid eligible, then you get mileage reimbursement. And the typical response that I get is, no, I don't need them to come pick me up. I have a vehicle or I have grandma that's going to drive me. And I said, I understand that. I said, but Medicaid also pays mileage reimbursement just like this program does. And I guide them in the steps on what they should do in order to reach out to the appropriate contact to get their mileage reimbursement. And what I always tell the client, or our mobility navigators always tell the client, that if they are denied through Medicaid, because there are several instances where Medicaid will deny the trip. We've also got clients that sometimes will schedule their trip through SoonerCare or Sooner Ride. And then all of a sudden, the day before, they get notification that somebody can't come get them and that they can't find a ride for them. So therefore, they don't get the trip. In those instances, we can absolutely put this through the trip mileage reimbursement. We just have to have that denial or that notification that that client will not get the resources that they need. The problem that lies with that is that a lot of times when that happens, it is because they are using some form of public transportation. And if that's the case, this program does not pay for public transportation. It only pays for an individual who is driving themselves or knows someone that will drive them. But a lot of times, what we've also seen is clients that won't ask someone for help because they can't pay them. And this program allows them the ability to reach out to that friend, that neighbor, that church member that may take them. And that check goes directly to the driver. It does not go through the hands of the client. We do the intake on the client, but the money goes directly to the driver. And that eliminates any change of hands for the check and the delay of the payment. And so that goes directly to the driver. So like I said, we talk to the client. It's a very, very short intake. We ask the basic information. And then what we do is we guide them on how this program works, how they can return the form to us. And they can either, we tried to make it as easy as possible. They can email the form, they can mail the form, or they can literally take a picture with their phone front and back and text it to the number provided. So that way, hopefully, we're covering pretty much anybody that, whether they're tech savvy or whether they're not, would be able to return the form and get the mileage reimbursement. As Julie said, when we get the form, we look over it, we double check and make sure everything's completed. But I also tell the clients you can't mess up. If you mess up, I promise you, we will call you and we will try to get it situated or get signatures from you. However, that does delay the payment a little bit, but we will make sure you get your money. So, what I will also add, and this is kind of the human aspect of it, is just today, one of our mobility navigators went to a senior center and was basically doing an in-person sign up. And he literally had 3 people break down and cry because this is a program that so many people who are utilizing the program has never received assistance before. And it's these Medicare clients that are unlimited income. However, they do not qualify for Medicaid. This is these private insurance people. These are our chronic disease people. These are our cancer patients. These are people that just have decided to typically cancel their appointments because they don't know who can take them and they don't know how they're going to get there. And they won't ask anybody because it's a bother. And another example that I always give in that point is I had a lady that I interviewed, and she was diabetic, and she had an ingrown toenail, and she had family, and she didn't want to ask them for help. And so she just kept canceling appointments because nobody could come to her very rural community. And so by the end of a year, she ended up being a double amputee. And that was simply from an ingrown toenail that had led to an infection. And now she's living off the state in state funded housing and can't work. So if you look at that and the things that we've pointed out to our state departments and our legislators, is this is saving our state money. Because when you have, that's one example of one person in a rural community. We have a ton of rural communities in the state of Oklahoma, and this is just one person. So you know these stories are out there. I've had people that have told me that they were cancer patients, and before I had this program, and I've told Julie numerous times, I have drove home crying because I can't help people. And I had a lady that had called me, cancer patient, and I couldn't find help for her. This was before this program. And she said, "That's okay. I appreciate you listening. And I'm just going to wind up having to sit here and die because I can't get there." We had a client the other day that came in that is a transplant recipient, but now has cancer. And she was to the point of calling hospice because she could not afford to go back and forth. And she broke down and cried in the office because she said this completely changed her life. So this is what that program is doing. And we are just now getting it started. So our outreach, even though we've had quite a bit, what we're looking at is word of mouth. Going to the people, going to where they are, sharing this information on, every platform we can share. And believe it or not, and Julie mentioned it before, and I've given her this analogy. I expected it to blow up. I did not expect the atomic bomb. It has been incredible as far as the response that we've had on this. It is a pilot program, so of course we're going to have some bumps and bruises, like Julie said, but just the remarkable amount of people that we are serving. And Julie can probably go in a little bit more on, maybe how many, but I think up to date, and I may be wrong, but up to date, we've put about $27,000 into Southwest Oklahoma in the last 3 months. So that's to us a significant amount of money that has given people the ability to get where they need to go. And it doesn't fix all the problems. We definitely, you can only serve the ones that have access to a vehicle or access to someone with a vehicle. But as Julie will point out probably a little bit later, there is a future for this 5-year grant. So I think I'll turn it over to Julie and let her kind of talk to on that aspect.
Can I ask a question before we switch?
Yes.
You
Yes,
said you
absolutely.
you said you asked them if they have insurance. Can you kind of elaborate on that? I didn't get to write it down. So if they have
Okay.
SoonerCare, they can't get the reimbursement, correct?
So basically, if they have Medicaid, and that's one of the first questions we ask, and again, they always need to call the mobility navigator first, but we do ask what health insurance they have. If they are Medicaid eligible, then we ask them to put, if it's a medical trip, we ask them to go ahead and try to get mileage reimbursement for it. If they are denied and we don't have the ability to override that, so typically if someone's denied, they can reach out to me and I can reach out to Oklahoma Healthcare Authority if it's due to excessive mileage, which just like Julie said, in rural Oklahoma, you're traveling a long ways to go to your basic doctor appointment. A lot of times through SoonerRide, those are denied because it's over what they consider the allowable mileage to get to that appointment. That's where they contact the mobility navigator and say, hey, I got denied due to over mileage. Can you help me? We can't ever promise we can get it done, but typically, I mean, I would like to say my percentages are really, really good. The only time I've ever been denied is if they did not give me enough time to get the response from Oklahoma Healthcare Authority, or if the client typically just picked a doctor that they really liked versus someone that is in network or, what they would consider the closest facility. So we can get that overrode. If we cannot get that overrode, then that's where we can utilize the trip mileage reimbursement program. And on top of that, we do right now with our Medicaid clients allow food access to be utilized through the trip mileage reimbursement program because we do know that some of our Sooner Select plans give some options for food access, but it's also combined with a lot of other different services. And those are only like 10 or 12 per year. We allow food access for up to 4 times per calendar month. We are going to have a meeting with our Sooner Select plans, but until then, we are signing people up for food access until they tell us differently. And I can't imagine them telling us differently because they can't provide the amount of service that we're going to be able to provide. So one way or another, we're going to figure that part out. But yes, Medicaid clients can utilize the program. If it's medical, they must get the denial, give us a screenshot of it or a copy of the letter or something like that. So they need to be sure and go through the process. They need to call the Sooner Ride number or their ride assistance number if they have a Sooner Select plan. But you can still call the Sooner Ride number and still do the same thing. They need to do that at least 3 days and ahead of time, which are business days. Allow us the ability to get that overrode if possible. And if not, then we put them through the trip mileage reimbursement. I had one today that I worked on that was a Medicaid client, but the facility they was going to was a specialist and Medicaid wouldn't pay for it. So, again, that's where they just reach out to us, let us see what we can do. But across the state where this trip mileage reimbursement program is not available yet, we still have mobility navigators that can assist with the Medicaid transportation. So I did drop in case you hopped on, and Marissa, it's good to see you. But in case you did hop on later, there is a flyer and the website for our mobility navigators across the state. You can reach out to any one of those and ask for assistance for the Sooner Ride overrides or help with that.
One example I can think of where it would be almost a guarantee for the trip program mileage reimbursement is if on a Monday or Tuesday or whatever, you need to get your child into the doctor that day. And that, you're not going to get the three-day window. You still have to go through that process. So you can be denied. But, if the doctor can see you that day, you're going to take your child. And usually that happens on a Monday or right after a holiday. So, there are ways that we are using this to help with our Medicaid SoonerCare clients. Another would be when we were developing this program and the guidance, we had several meetings with DHS and DHS caseworkers, and there are kiddos that are being put in behavioral facilities that are 3 and 4 hours away from their parents. And the parents have, Medicaid doesn't pay for them to travel to visit their kids or to go to counseling with the kids. This program would do that. And it would also, when that child is discharged, if they were taken in by ambulance or some other means, this program would allow the parent to apply for the mileage reimbursement to go pick up that child, because we have been told that there have been cases where the facility was trying to discharge and the parent didn't have the money to come get the child, and they were going to turn the parent into the DHS for abandonment. So we want to make sure, number one, our vulnerable populations, which I include children in that, are getting the services they need. And we are out of the box thinkers, and we can't guarantee you 100% of the time, but we're hitting it about 98% of the time that we're going to find an answer some way or the other to get you there. One of the things that when we were developing this program, I worked with Terry Kinder on a board. My youngest child, has dyslexia and some other learning issues. So we've battled through IEPs and specialists and everything. And Christy was a special ed teacher. So we have that heart for families with kiddos that struggle. One of the things that we do make available, there are resource centers for families with kiddos. There's one in Marlow called Grace and Me, and they have education events to bring the families in, whether it's learning about their IEP or other services. That is eligible for the families. That is an education component, just like if you were needing to go for diabetes education. Now, if they're going to a skating party, we're going to say no. But if it's at their facility and they're bringing in speakers and it's an education component, absolutely, we're gonna be, the questions will be asked. But those are the kind of things that SoonerCare doesn't pay. And we understand why they've got limitations, but we're just trying to make a difference and move that needle to get families and their kiddos and their parents healthy.
Well, and we might add to that also is that in our program, you have to be at least 18 years or older in order to be a client of this program. But that does not mean that a parent cannot take a child. The reason we have the 18 plus age on there is because we do have that form is signed that transportation was provided, and legally an under 18-year-old cannot sign a form because there's an attestation on there. So we put the information under the client, that would be the parent, and they can take their child. So let me give you an example. So the one that I worked on today, she, of course, was denied by SoonerCare. She sent me the denial, and it was her children that was needing to go. And so I just put the information under her name so that she could take her children. We also have examples of people who are on Medicaid that use the program, especially those ones that call us and never knew that they had mileage reimbursement. They have typically missed the 3-day window because they didn't even know about the window. So we can sign them up the first time, give them the resources to be able to call from this point forward. And we will make also another point, we are looking and double checking who turns in stuff. If it's a Medicaid client that keeps calling and always misses that 3-day window, of course, we're going to turn that down. Just because, in most cases, you would be able to call ahead of time, but we also understand case by case, there's extenuating circumstances from time to time that you're going to either not get that ride or be denied or miss that 3-day window for a reason, like Julie said, is the kid wakes up sick. Doctor says, if you can get them in now, I'll take care of them. So those instances will rise. It's just, we do look to see if, it's being abused, because we definitely want to guide them the right way, because we have a great partnership with Oklahoma Healthcare Authority, and we want to ensure that partnership stays. And, they're going to benefit us. We benefit them by helping their clients. So just wanted to kind of point that out as well.
And we also made sure that, because Christy answered so many calls as the mobility navigator, and one of the things is people would need to go to a facility to be assessed or to go to Social Security to fill out the paperwork to determine for disability. And SoonerCare doesn't provide that coverage. You can't use mileage reimbursement. You can't do the trip. So when we, like I said, when we looked at that. So if your kiddo needs to go for an assessment, like the family that Christy was talking about, SoonerCare wouldn't pay for it because it wasn't the closest one, but it was the one that could get her in the quickest. And sometimes that's more important than going to the closest one. Which one can get you in? If you ever have a child that's in crisis, you want to get them in as quick as possible. So we, going to the Social Security's office to apply for disability, to get paperwork, going to get assessed so you can see if you're eligible for disability. Those are some things that make us a little bit more unique than SoonerCare. So just because you have SoonerCare or your Medicaid, there are extenuating circumstances where we cover things that's not eligible for Sooner Right.
Well, I just gotta tell you guys that anytime somebody comes in here, I give them a trip form and I give them a Hunger Free Oklahoma form. So I don't know if they've told you, but I hand those out like candy. And I put some in the IEP meeting downstairs.
Wonderful. Yes, actually, I do know Marissa because I didn't know who, but when they told me where it was, I was like, oh, I know who that is.
Yeah, well, I mean, ever since you sent it to me, I mean, I
Yes.
literally, the first thing I explain to people is the SoonerCare, and we go over this. I ask them if they have insurance, and then we do the trip forms.
Yeah.
But the other one I want to bring up before I forget is it's called Ride Care,
Mhm.
and they do the, if there's a minor, they go pick up the parent and take them to the facility to pick up the kid, the minor, that kind of thing. So that
And
makes.
actually, yes, and Marissa, to add to that, the mobility navigators can actually do those referrals through ride care as well, because it has to be done by a physician,
Case
a
manager,
police case
director.
manager, yes. But we as mobility navigators can also enter that information in. Now, I know that ride care has recently kind of had their hands tied on some of the Medicaid trips, especially when you're looking at substance abuse and some of those treatments. However, I have utilized ride care. They have definitely came in clutch when I could not get Sooner rides. So it is definitely one of those things that your case managers, community health workers, any of those people can utilize ride care. The client themselves cannot. So that's why they would have to go through case management, mobility management. We're sometimes the easiest one to get a hold of. So, but sometimes we're not. But like I said, it's definitely an excellent program. And they will take Medicaid clients because they can bill them. Sorry, Julie.
That's all right. So we've given you a lot of information, and we don't want to go. This slide this presentation goes into a lot more detail than you're going to want to see. But this slide right here gives you the types of trips that are eligible. So when we talk about food banks, we have, and Christy and I, we learn something new every day. We had a meeting with the regional food bank representative, and we were asking the difference between food banks, because there are food banks in Duncan, but there's a food resource center in Lawton. And they said the food resource center is a food bank on steroids. And anybody within a zip code, it serves certain zip codes. Some of the small food banks, when you go there, you can only go there once a month. And based on the family size, you get so many pounds of food. Well, if that food bank doesn't have the volunteers or the money to buy all the food, then you don't get all the food, or you may not get the fresh meats or the fresh vegetables. So going to the food resource center, it's not just the food, but they have resources available for other opportunities. So when we learned about food resource centers as being a food bank, but we also look at during the summer the meal program where the parents can go pick up the meals for the kids for school at the school sites or wherever. That's eligible. So we make sure that, and that kind of goes back with that Hunger Free Oklahoma and getting people healthy. If your kids are home during the summer and you're needing help with, feeding them, can you use the mileage reimbursement to go up to the school and, pick up the meals? Absolutely. But you got to call that navigator first, or it can go to the farmer's market, not just the grocery store. And you'll see on this page, it tells what a definition of a grocery store is. But
Well, what
we try
about here? We have food boxes here that we provide our clients and concrete supplies.
you'd be a food pantry. Yep.
Go.
The health department, some of the health departments have emergency rations. So, whether they were going there for health or for the emergency rations, that would be covered. So today, and I think one of the things with this program and the partnerships that have been developed over the last 3 years, it's opening doors in rural Oklahoma. So I got a call today to see if we would write a letter of support. The OU College of Dentistry and the Dental Foundation is writing a grant to HRSA to open a 4-day-a-week clinic in Jefferson County for dental services. And it's open to all residents, not just Jefferson County. And they knew we had a transportation program. And so they wanted to, explain how the transportation program could help get people to the dental clinic. And so, those partnerships are building, and it's just making our regions healthier.
And I will also add to the point where we were talking about, be sure you call the mobility navigator. Encourage anyone that you talk to be sure and leave a message, because our mobility navigators typically will not answer the phone right away because they are literally on the phone at all times. So encourage them to leave a message, tell them that they were calling about the trip mileage reimbursement or whatever issue that they're having. And then when the mobility navigator calls them back, and let me just give an example. We have, Timmy that calls in and he has an appointment tomorrow, but the mobility navigator doesn't call him back till the day of his appointment and then can't get a hold of him because he's at his appointment. We can always backtrack that voucher number to that point because you have tried to call us and we were unable to get back with you that same day. So again, have them leave a message. They will get a phone call back. We get some people that, seem to get upset because they think we'll call back right away. It is very hard. We have a list ongoing at all times that, they're trying to make those phone calls. And, just sometimes you're on the phone for 15 minutes and sometimes you've got someone that has multiple needs that's going to require a little more time. So again, like I said, we want to be sure that we are explaining this to every client. We're taking the time to visit with every client and answer questions, but also they're calling in to basically give us the next appointment. So when we do that, we do ask that clients, if they're already enrolled, and they leave a message or they send an email or they send a text, always include your name, because so many people will call and then they'll say, hey, I need a voucher to Walmart. We don't know who they are. We don't know which Walmart. We don't know anything. So when they do that, they need to give their name. They need to give where they're going, the address they're going to, and if it is an appointment, what date is it? And then we can respond quickly with their voucher number. That way they'll have it. But if we don't have that information ahead of time, then it takes a phone call, and then you got to figure it out. And then we got to go back on the computer, get the voucher number, and then call them back. So it's just a whole lot quicker that if they will leave all that information on there, we can absolutely return the call and then be able to give the voucher number at that time.
Renee,
Yeah,
we're pretty much through with our
Okay.
PowerPoint. So
Okay.
if there are questions,
Yeah.
I know we gave you a lot
Yeah.
of information, and this program, as far as TRIP, is not rolled out to the whole state, but the information on, sooner ride trips and overrides and mileage reimbursement, we will answer as many questions as we can. And
Okay.
if we can't answer it, then we'll get back with you.
Okay. But can I ask a question?
Yes.
I have a few. So when you say name, so you want people to leave their first name, last name, phone number, ideally, and where they're going and the address of where that is. And then if it's a medical appointment, the date of the appointment. Is that
Yes.
right?
Yes. And
Okay.
especially this is when they've already talked to the mobility navigator. And
Okay.
so a lot of times, once we have done that initial intake,
Yes.
typically we can just find out where you're going. That initial intake does not take very long. And if it's more comfortable for the person that says, hey, this is Johnny. I was inquiring about the trip mileage reimbursement program. I have some appointments coming up. If you could give me a call back and leave their number, then we can go through the whole thing and do that. But if they're already enrolled, yes, that's extremely helpful. Then we don't have to make multiple calls back to them.
Got you.
And we have 3 navigators across our
Mhm.
16 counties. So they're grouped strategically, but if anyone's off, the other ones are covering the calls and stuff.
Um, but I know that I wondered how many people that you have served so far.
So
Do you have
far,
an estimate on this?
there were so far since March 30th, there was
Yeah.
over 1,200.
Wow.
And
Um,
that's 20. So the statistics are depending on what county, but overall we're reimbursing at about $60 per person per trip. And mileage is about 80 miles.
wow.
So some
Um,
people have multiple trips and they submit, one mileage reimbursement that they've used all month, or maybe it's, they need it, after one trip. So we also have what's called the $10 minimum. We're looking at that a little bit more strategically. We found some abuse in that, whereas if your mileage was less than 16 miles and for a trip, then you automatically got $10. But we've got people going to the grocery store one day, going to the pharmacy the next day, going to the doctor's appointment the next day. They all are less than 16 miles, but that's $30. So we're looking at in October making some changes. Probably it's $10 per week for minimum,
And we'll
and
also,
learning how to trip
yeah,
chain and combine your
yeah.
trips to
And we're
meet that.
also looking at when we're talking about this with the mileage reimbursement and everything. We have a lot of clients that are going to the same place numerous times. So maybe they're getting dental work done. And so they got to go get the x-rays and then they got to get the implants. We can do reoccurring voucher numbers. We do that with our food access. We do that with our cancer patients, our dialysis patients. We do a reoccurring voucher number. So they will use the same voucher number for a period of time. Usually we will do 3 months for food access, maybe a month if it's just a dental process or something. If it's chronic disease, we may extend it a little bit longer. But the reason we have an expiration date on it is not to say, okay, at the end of that, you're done. But it's so that we will call them back and find out how's it going? Are you still going to the same place? Is your time that you're going still good? And this also, like I said, is a grant. So we want to talk to our clients. We want feedback. And so we will call them back when they're getting close to their expiration date. And we will tell them, hey, it's close to your expiration date. Is everything still good? And we can reissue another recurring voucher number, depending on the circumstances.
Cool. Gosh, it seems like you've already helped a significant proportion of the population. I wondered, out of the trip purpose, what is the highest percentage of trip purpose that you see? Medical, health programs, provider recommended, or what?
Medical is the number one, about 70%, and then food access is 21%
Oh, wow.
for this first quarter.
Yeah.
I just pulled up some reports. So in April we had 134 vouchers issued, and in June it was 578.
Oh, wow.
So
That's a
that,
jump.
and
If
so
we keep doubling, we're going to be in trouble. No, I'm just teasing.
and so
Wow.
as far as vouchers by age, we had for the age group 35 to 49, 149. The
Oh,
age group 65 to 74, 350. So
wow.
we're covering a lot. The destinations are usually the dialysis center, Walmart, Jackson County Memorial Hospital has a high number. And this was, and then those were the consistent sites. Beckham County, which is the Elk City, Sayre area, they've had the highest number of vouchers issued.
Mm.
Where and Great Harmon counties had the least amount.
Mm.
So I think it's not just the population, it's where there's actually zero transportation available. So we work, Chrissy, the navigators all work closely with our tribes and the demand response systems, but it's just it's a good thing. So in Jackson County, the average is 41 miles per trip.
Wow.
In Kiowa County and Greer County, they had one trip that was 244 miles.
Wow.
Just
That's,
depending on, where they're going.
Wow.
So,
wow. You might not have a number on this, but what proportion of the folks that you serve might be families of someone that might have a special healthcare need or disability?
we don't ask that.
Okay.
We don't ask that. We were when we developed the criteria or what we wanted to ask, we asked your age and the county you live in.
Okay.
We don't even ask the set. Yeah, we do ask for male or female, but we don't ask race. We don't ask how long you've lived here. We don't care. We don't ask your income. We figure if you're calling, even though there may be some people that may abuse the system, if you're calling, you need help. And it doesn't matter, what your ability, what your disability, what your strengths are. So we wanted to make it as least intrusive as possible for a federally funded program. So
no, I wondered what your budget was. And I know you said the big beautiful bill, but I've just seen with the amount that you double, that's just wow.
So my first year, we budgeted $100,000 for mileage reimbursement, and our year will end October 30th, and we will have expended that plus more. We're probably looking at about 125,000.
Wow. How
for
are you going to
for
pay
7 months.
overage? Oh, wow. For the overage.
So when we're working on our year 2 budget, we're going to be looking at, what's that going to look like? And as we keep growing, right now we reimburse at 60 cents a mile, but we're going to have to look at, if this keeps growing, how do we cover everyone? We may have to look at, instead of 60, maybe it's 50. We don't have the answers. We're the pilot program and we're still trying to figure this out, because whatever we do will roll out to other regions, and we want to make sure that we're not changing midstream in other regions. We want to make sure that when we start this, when it goes out to the other regions, we're all steadfast on everything.
And like Julie said, when we're looking at this program in October, we knew we had a half a year to cover what we allocated for a whole year. So of course we have done the medical unlimited. We've given a little more leeway to food access, pharmacy, and things like that. Come October, there will be changes. It may be changes to the amount and frequency and stuff, but we still look at, the scenarios, your chronic disease, those things are things that you're going to want to kind of leave alone. But again, like I said, we may have to look at how much money we're doing. We may have to look at combining food access and pharmacy. So that'll eliminate a few trips to where they'll have to kind of think, okay, when I go to the pharmacy, let me get my groceries at the same time, But again, when we're looking at this program and we did not ask specific, information, one of the most frequent things that gets said to my mobility navigators and myself is, oh, I don't qualify for that program. And I'm like, yes, you do. I said, I'm not asking you your income, but the thing is so many of these clients think that so many of the programs that we have out there, which is true, you have to be low income to, do this. But we have so many people out there that are on limited income but don't qualify for Medicaid. That doesn't mean they have an expanse of money that they can spend. And if you have a chronic disease, I don't care how much money you have, that money's going to be gone. And, those trips are going to get to the point where you can't afford it. And so that's what we're looking at helping. So when we don't ask their income, the reason we don't ask is for that very reason, is because we don't want them to say, oh, I don't want to mess with that. And I know I'm not going to qualify, so I'm not going to do it. I've said this over and over when my mom was sick. I wish this program was there because all those trips to the city, when you're going over and over and over, I don't care how much money you have, if it's a strain on the family, if it's a strain on the pocketbook, and that's who we're trying to serve.
Wow. I'm just so grateful, honestly, for you guys, because just in working with a couple of families here in the last few months, you guys have been able to be a tremendous resource to, like you said, families that didn't feel like they could qualify for, programs, and families who have even done all the right things with SoonerCare and still receive denials. And I just appreciate you guys, connecting some of the dots, because, but like you said, a lot of these families will go back and forth. They'll go from a small community like Nowata all the way to Bartlesville, even though that's not a huge distance. But I mean, if you're
It adds
going
up.
multiple times a week, it adds up really quickly. And I was talking to a family, and they were taking their child to Bartlesville for physical therapy, and their son was a foster, and they're adopting him, but and she was just blown away that I wasn't just going to refer her back to the website. I think it's great that you are humans and you have acknowledged that, you're not robots, obviously. So it might take you a minute, you're on the phone, you're talking, and you will interface with other humans. And um, that just goes a long way. And that's just me. I'm just one little corner of, even though you're not like statewide, you will go above and beyond. At least that's been my experience. And I just wanted to say thank you. I don't know if anybody said thank you, but this is the coolest. I mean, I'm excited. Granted, Bartlesville's Washington County has about 50,000 people. I don't know, it might be a little under that, but it's just amazing and it's so extensive. So like, because rural things don't work the way they do in metropolitan areas. You know what I mean? Like, if you want to go get a hearing screen on a baby, it's a lot. There are more pediatric providers in metropolitan centers than there are in rural areas. Even in Bartlesville, things don't work the same way as they do in Tulsa. I consider Bartlesville kind of rural, I guess, but it's not super rural. But um, just allowing, and just hearing these families call, and they need to get their kids to those appointments, because if you miss out on those small windows of like early intervention, or the earlier the better, really, for any health outcome. It's I'm just so grateful that y'all are here. And I know you guys, I'm gonna zing you a bit. You had mentioned some challenges, bumps, bruises. And I know you guys had said, obviously funding, that's a big one. And maybe some people using that $10, would you mind sharing a few other bumps and bruises that you might have had along the way that you go
Well,
ahead?
yes, I can share a couple of them just from the form portion of it. We've really tried to dial into what we share with the clients on how to get them prepared to fill out the form. Even given examples, we even, depending on the capabilities of the clients, I have filled a form out, highlighted it, and stuff, so they would have an example. A lot of that has been, when it comes to paperwork, we're looking at ways to, just like we'd said before, to try to eliminate some of what we would consider could be abuse. And again, like I said, we're never going to eliminate all of it, but to do the best we can to eliminate as much as we can. And the influx of phone calls. We have had to learn ways to try to make this faster. My poor mobility navigators, I'd walk up to them every day going, please don't quit me. Please don't quit me. And they're just sitting back in their chair going, this is a lot. And I'm like, I know it is. But we're trying to figure out ways to make that faster, to make it easier to talk to a client, especially if they're already as a client, what programs might be out there when we do send this out statewide. How is this going to be faster and more efficient? And so those are the things, I am an old paper girl. I do everything by paper and pencil. And thank goodness we got tech savvy people, because I'm like, you don't even tell me how you're doing it, just do it. And then we'll look at it, because there is better ways to do it than what I know. But that's what we're kind of learning as we go to make it better, faster, and more efficient when we're trying to deal with our customers.
Wow. No, I appreciate you sharing it. And I appreciate you guys just with the partnerships that you guys have built. I mean, you had mentioned, healthcare authority, health department. You said tribal nations? Would
Yeah,
you
tribal
elaborate?
nations, our bases. One of the things that we looked at when I first started as a mobility navigator, the reason the Sooner Ride thing all came about is because that's what I kept hearing.
Mhm.
I keep getting canceled, or I can't get my ride with Sooner Ride. And this is what I heard from health department. This is what I heard from transit agencies, from individuals. And so it took us a while. But thanks to Julie, I always call myself the best tattleteller ever, because I will go and cry to Julie, and then Julie makes it work, because I'm like, okay, this is what I'm hearing. I'm upset, fix it. And so she does. And so we created this collaboration with Oklahoma Healthcare Authority and Sooner Ride. So I have direct contacts with Motive Care as well. And, that has made a huge difference in the ability to help our clients. When we're talking tribal agencies, this started through the transit agencies, our tribal transit. And I got the best piece of advice from Cheyenne Arapaho tribes. And one of the things they mentioned to me was that so much of the time they're left out of the conversation. And when people include them in the conversation and work to collaborate with them, then they're very excited to collaborate with us. And I have done numerous things with our tribes, and it's all on the transit side. But it's just, it's one of those things that it takes time. I have been told no so many times. I have even been told that the only reason I'm talking to you is because I have to. And I'm like, well, technically you don't have to. But I had one transit agency tell me, and I laughed. And he said, you're kind of like a gnat. You just don't go away. And he said, and I mean that with all the love in the world. And I was like, well, eventually you'll tell me yes. So it's that kind of stuff that I think mobility management and the programs that we work through, like our councils of government and our transportation planning organizations, those resources we have within our councils of government and our transportation and mobility management are things that build and connect us to the people that we need.
And, and I think that through our planning process, and Christy has said this multiple times in other situations, you can't wait to build the partnerships
Mhm.
when you need the grant. You already are that program. You need to be building those partnerships now. And through our planning process, we have a very strong collaboration with CHIOs and health departments and Ministerial Alliance and nonprofits and government offices, to the point that we're recognized as a leader in Oklahoma for rural transportation. So if I could give one piece of advice, is build those partnerships now. It doesn't, that partnership could be with, I see Sheila DiCarlo on here. That was what, that's one of our partners. They have a family resource center, they're a partner. you reach out and find your partners. It could be the Senior Citizen Center. It could be, it could be any of the churches, because in Southwest Oklahoma, our faith-based community is one of our strongest assets. And we choose to use our assets and know what our assets are. So, find your partners, start, even if it's a lunch meeting once a month, find those partners and start talking to them and building that relationship, because as this trip expands, it's going to be through those partnerships that you get this information out. You ask about one of the struggles. My biggest struggle, besides keeping the navigators happy and excited to come to work every day, is going through all the red tape. So a press release or anything that we publish that's used with this federal funds has to go to the health department, then has to go to Centers for Medicaid and Medicare for approval. Well, I like to get it done. Here it is. Let's get it done. And we wait. And it's just like, oh, I need that form now, but I can't. And, so as we progress and expand, all of those forms are already going to be pre-approved. The other regions, all they'll have to do is to change their logo, change our logo, and add the different names, and they won't have to go through that. So that's one of my bump knees, is learning to be patient with the federal government.
Oh gosh, thank you again for being the pioneers in this and saving the rest of Oklahoma that the ways that you have described, because you're right. In one of those families that I had helped, she just said, honestly, the Sooner ride was almost, there was so much red tape. What's the point? That just about broke my heart, because she said this thing is supposed to help us, but we don't really need it. But it's that just about crushed me. I was
One of the things, and I may have shared this with you already. Oh, I just lost my head. Is that when they're navigating Mara, which is the automated system, and it's in my flyer, so you probably have it, but one of the things they can do is just say the word agent over and over and over, and they'll get a live person. I have had many people that said that they had cussed Mara out, and I said, well, how'd that work? And they go, not so well. But that automated system can be very frustrating, because press 1, and then you have to go, and and you're on there forever. And but if you do say the word agent over and over, it will bring you to a live person or a place where you can leave a message and they will call you back. So that is probably the best bit of advice that given to clients and stuff. And one final thing that I'll say that kind of goes with Julie is when we talk about collaborating, and I have said that on every presentation that I've done, if we had not had this collaboration with the State Department of Health and with the health departments and stuff, we may have never been pulled to the table to even get this grant. And again, where it plays in is that we had built that collaboration way before we ever knew about this grant or could have utilized the funding. So that was what helped us along the way. And this collaboration is key. Even when you think you may not need them, you'd be surprised when you might need them. And they need you. So it's a vice versa.
Thank you guys, because I have I have several parents. They have to get their kiddos to specialists in the city. And they're on SoonerCare, but because of the mobility, and mind you, these parents are in-home paid caregivers, so they're on a limited income, and they have to go to specialists sometimes even twice and 2 and 3 times a week from Weatherford, and that gets costly. It's really sad to hear them say that. I mean, like you said, I don't need it, but it would help. So
yeah, but if someone is saying that, they need it. It's one of those deals that they say, I don't need it, but it would help. That means you need it.
And even if they can't use the trip program for the medical appointment, going to that grocery store, that's a big lift, because how often do you get a chance? There's not another federal program that I know of that will reimburse you to go to a grocery store, or to a food bank or to a senior citizen center to eat. And so Christy has told some of our ministerial alliances, you may not think this is, you may not want to talk to people about it. You may not support it, but if your constituents and your members use this and you support it and help them, then they're using the money for TRIP instead of the church's money. The church's money can be used for something else, for that congregation, or for a particular person. So, like I said, we're trying to link and loop in everyone that has contacts.
So it would count, say, in Bartlesville, we have it's called Agape Mission, and they feed people lunch 5 days a week. That would count as a,
Yeah.
I mean, okay.
Because, and as of right now, and again, it is a pilot program. Everything is subject to change on the duration and how many times you're going to do that and all that kind of stuff. However, congregate meals and those type of resources are separate from what we do the food access. And again, like I said, it is a pilot that is subject to change on the amount and the frequency that we can do it. But like I said, it is what we call a separate entity.
Thank you. I wanted to thank you guys again. Does anybody have any other questions? I've asked a lot of questions, and I really do appreciate other people chiming in. And if not, I put our Toolbox Tuesday evaluation in the chat box if you wouldn't mind filling that out. That kind of helps us just, we always want to know how we're doing, right? I mean, it's just making progress and all that good stuff. But thank you guys so much for being here.